Welcome to Health Statistics on the Web. My name is Christine Neiman-Hislop, and I'm the Data Education Librarian for Region 1 of the Network of the National Library of Medicine. And I'm teaching this class today with my colleague Katie Pierce-Ferrier, the Data Science Strategist for Region 3. And we also have Molly Knapp with us who from the National Training Office, providing technical assistance and keeping an eye on the chat. Just please make sure to post your chats to all participants to ensure Molly, Katie, and I can see them. I have just a few informational items to cover before we dive into our class content. The chat box is closed by default, so to open it, look for the chat bubble icon on the bottom right of your screen and click on that. We also do have live captions available today. You can find that in the multimedia panel located near the chat panel. You may need to scroll down in the box and click the link to start the live caption stream. All attendees have been muted to cut down on background noise, but we do welcome your questions and comments in the chat at any time. We'll each be taking a look at the chat, and Molly will be queuing up the questions as they come in to save for us to address during one of the question breaks that we've built into the class. We are recording today's session, and we'll post it on the NLM YouTube channel in 1 to 2 weeks. At that time, everyone who registered for this session will receive an email from us with the link for the recording. This class is eligible for both Medical Library Association and Certified Health Education Specialists continuing education contact hours. You'll be able to claim your CE through the evaluation link we share with you at the end of the class. Just in case this is the first time for anyone, any of our attendees today, we want to just start by sharing a few words about who we are. You may be familiar with some of the acronyms on the slide, but unsure of how they relate to each other. So we have the NLM, which is the National Library of Medicine. It is one of the 27 institutes and offices of the National Institutes of Health, and it is the world's largest biomedical library. It produces online resources like PubMed and MedlinePlus. The NNLM is the network of the National Library of Medicine, and it is an outreach program of the NLM, working to ensure health professionals and the public have equal access to health information. The NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. If you'd like to connect with your regional medical library or learn how to become a network member, you can find your region and check out our website at nnlm.gov. We have 3 objectives for our class today. They are to recognize the differences between data, data sets, and statistics, to understand a 4-step process used to locate relevant health statistics for a particular circumstance or issue, and to identify online resources that provide health statistics at the national, state, and local level. We will not be doing any math or talking about how to calculate statistics today. Instead, we'll be focusing on how to locate and select health statistics that are available online through free, high-quality resources. We have a few class materials to share with you, so if you weren't able to download these prior to class, Molly has been putting the links to the materials in the chat. We have the presentation slides for your future reference. There is also an online table to use to help find health statistics by topic within the resources we'll be covering today, and also a guided handout for you to use during this class. The handout has a few questions on it to test your knowledge, and it also lists the resources we'll be covering today. There's space for you to make your own notes on each of these resources, and it also provides space to work on our in-class exercise. And so our agenda for the next 90-ish minutes begins with a very brief overview of data, statistics, and their uses. We'll then talk about the steps to finding relevant health statistics and take some time to do part 1 of our class exercise. We will spend the majority of our time after that exploring 8 key resources for health statistics through live demonstrations. When we reach this part of the webinar today, you can choose to either watch along with the demos or you can follow along on your device. And after the demos, we'll return to do part 2 of our class exercise, and we'll wrap things up by answering any remaining questions. And now, time to dive in. A good way to start talking about data and statistics is to define what they are and also what they are not. So data are the raw numbers or individual counts of something that have not been processed or cleaned or organized in any way. A data set is a collection of data managed in an organized form according to particular criteria. And statistics are data that has been analyzed or summarized in a way that makes it actionable, helping us to answer questions like how much or how many. Much of the health information that we see reported is in the statistic form. It can be presented in a variety of ways, such as percentages, graphs, tables, figures, or even a map. One definition of statistics is a numerical summary of measures computed on samples. Health statistics are a numerical summary of data that characterize the health of a population and the influences that affect health. A population could be an entire country or a neighborhood. It could be all adults in New England or all Asian American children in California. Because you can almost never measure an entire population, we take representative samples and analyze them. Samples are often collected over a specified period and are large enough to conduct adequate analysis. This then enables us to estimate various parameters. Parameters are values that describe a characteristic of a population, such as birth rate, disease prevalence, or education level. While there are many important uses of health statistics, which we'll also touch on in the next slide, it's important to remember that statistics are collected to meet the needs of the collector. This means they can be influenced by the collector's perspective or bias, which could in turn affect what data is gathered to begin with or what outcomes are reported. So always look for remind you to always look for notes that describe the reasons for and the methods of data collection, and be sure to review them carefully. It's also good to remember that information on a topic may be collected in different ways in different surveys, and that estimates of the same statistic may vary between those surveys. For example, there are multiple surveys that measure cigarette use, and while each provides statistics on the same topic, the estimates of use can differ between them because they may use different methodologies, different sampling frames, questionnaires, and definitions. Health statistics can be used in many different ways. They can provide information about the health of a population and what influences it. And while statistics are population-based, they can also help an individual understand where they fit within the larger context of their community and identify the health disparities that exist between different community subgroups. Statistics can be used to track and monitor trends in health status and healthcare delivery. They can also be used to guide research, policy, and program development by helping us identify needs, shape how resources are allocated, and evaluate effectiveness and impact. Let's talk broadly now about how to go about finding health statistics using a 4-step process. The first step is to formulate a question. You may want to consider a certain age range, geography, and time frame that you need the statistic for. So some examples of your question might be, what percentage of adults aged 21 and over have reported having coronary heart disease in Kentucky in 2019? Or how has the rural-urban distribution of the geriatric patient population in the United States changed over the last decade? The second step is to choose the best resource to answer your question by thinking about who might collect the data to produce or publish the statistic you're interested in. So you can consider federal agencies, state and local organizations, or institutions tied to the subject of your search. That online table in the class materials can also help with this step. After you've decided which resource to use, the third step is to perform your search and evaluate what you found to determine if it is appropriate and sufficient to answer your question. This is where you carefully review the notes describing the methods used for data collection and statistical analysis. And then the fourth step is to repeat as needed, either for additional information or for a different question. So now it's time to break out your guided handout if you haven't already. And we're going to pause here for about 2 minutes to work on part 1 of our class exercise. So using step 1 of our 4-step process, formulate a question, you can formulate a question for a health statistic you're interested in finding today and write it down on your handout. Depending on the statistic you're trying to find, you may want to include an age range, geography, and or a time frame in your question. And those example questions that I shared with you a moment ago are on this slide for your reference. They're also on your handout. So we'll take about 2 minutes to do this. I think that's been about 2 minutes. How did it go? How did it go? Does anyone have any questions about this first step of the process? You're also welcome to share the question that you formulated in the chat. We also can pause if anyone has any questions in general. Molly, has there been any questions?
No questions as of yet, but we do have a few searches being shared in chat.
Oh, okay. Oh, I'm seeing what percentage of women over 65 are diagnosed with Parkinson's disease? It's a good one. What percent of teens age 13 to 19 use free mental health services in NYC since the start of the pandemic? Oh, I really like including the dates. These are great questions. Thank you, everyone. All right, I think we'll go on to our next slide. So we're now going to start looking at some of these resources for health statistics. And again, you can choose to either watch along with the demonstrations or you can follow along on your own device. As we explore these resources, feel free to make notes on your handout about which ones might help you answer the statistical question you formulated. We'll begin with 2 statistics portals. Our first portal is the National Center for Health Statistics, or NCHS. NCHS is the nation's principal health statistics agency, and it's been part of the Centers for Disease Control and Prevention since 1987. Its mission is to provide statistics and data to guide public policies and actions to improve the health of Americans. Because they are a federal agency, NCHS is required to adhere to quality guidelines to ensure the integrity of the information they provide to the public. These include using the best available science and statistical methods, being transparent about the data and methods they use, and ensuring information is presented in a way that's comprehensive, informative, and understandable. So for those of you who'd like to follow along, you'll find the URL for the NCHS website at the bottom right corner of this slide, and I'm going to share my screen now with the website loaded up on it. All right, so we could start by simply looking for a particular statistic by typing in some keywords in the search box in the upper right-hand corner. But since I'm going to be highlighting some different features of this resource, we'll pull up statistics as we navigate around the site. So the area at the top of the home page here is dedicated to news reports, data files, and resources that are available. So these will change out over time. And as we scroll down, we'll see there are several tabs. There are several tabs here running horizontally across the screen, such as programs, data and tools, publications, and these allow you to quickly navigate to different types of content. Further down, keep going, we see the What's New section. And to the right of this is the always interesting stat of the day. Today's stat, dementia is more prevalent in adult day service centers specializing in dementia care compared to non-specialized centers. And below the stat of the day there are some links here to content that's grouped for different users. So for example, the general public, researchers, and even students and librarians. NCHS conducts a number of different surveys to acquire data. And if we go back up to this list of tabs that we passed, under data collection systems are prominent surveys. You'll see some of these cited as the data source in many of the other resources that we'll be looking at today. So it's good to get familiar with them. They're grouped into 4 categories: population surveys, vital records, provider surveys, and historical surveys. We're going to start by looking at population surveys. We click on population surveys, and on this page we will see the title of each survey. We will see the data source and methods used and a list of selected data items. And this can give an idea of the type of information that we'd find in the survey. So I'm going to click on the National Health Interview Survey, which is one of the ways the NCHS monitors health trends in the country. And this survey collects information on the socio-demographic characteristics of respondents, which includes things like age, race, sex, education, employment, family size, and geographic region of residence. On the right side of the screen, you can click on Interactive Data Query System to start exploring. And we're going to start by looking at information about adults. So I think we scroll down and we find Interactive Summary Health Statistics for Adults. And click on that. And right away we see it takes us to a page where it lists the percentage of adult respondents who had ever been told by a doctor or other health professional that they had angina. And in this gray bar on the left-hand side, we can select different topics, under different health topics, and also different topics under each of those. So there's selected diseases and conditions, cancer, mental health. I'm going to select regularly had feelings of depression. You can see the different numbers. We can also look at trends over time, or we can narrow down to a single year. Go back to the trends over time. There's also, using the Group By pull-down menu, we can explore and access different socio-demographic characteristics. Let's see some of the examples here. I'm going to click on sexual orientation to view the available statistics separated by that characteristic. The National Health Interview Survey began collecting sexual orientation information with the 2013 survey. This is an area that has historically been limited, but both public health and clinical data collection is progressing. Currently, the survey includes questions about sexual orientation, but not gender identity. If we look under the notes, you can also find the code book. You can find the code book and more about how the survey questions were asked. I come back up to our list of characteristics. I'm going to select current asthma. It's another example, and look at family income. And here we can see income is presented as it relates to the federal poverty level, FPL, and we can see that how that affects or how the different percentages for adults with asthma, with current asthma. And I'm going to go back one page, so you can, if you're following along with me, you can press your back button. And now I want to look at interactive summary health statistics by race and Hispanic or Asian origin subgroups. So again, we land on an information page about percentage of adults respondents with angina. And I'm going to change this again. I want to look at current asthma and can see You can see the different rates. This plot actually, and so the plot shows how the highest rate, the highest percentage of is 15.6% is found in persons identifying as both non-Hispanic, American Indian and Alaska Native, and white. So race is based on respondents' description of their own racial background, and they have the option of reporting more than one race, which is why you have this category. We can also go one level deeper into the detailed groups for Asian and Hispanic or Latino persons, and to break it down by specific groups. So we select the Asian detailed groups. You can see the percentages broken out. And there's also Hispanic or Latino origin detailed groups. And these detailed groups, the definitions are all pulled from the census.gov definitions. And for all of the tables that we're generating here, the tables or charts, we can download this data. So there's a little download icon by the graph title, and you'll say download plot. Now I'm going to return back to the home page, National Center for Health Statistics, back to the home page, and I want to look at another data collection system this time. I'm going to look at the vital records. And the first one is the National Vital Statistics System, which provides access to official birth, death, marriage, and divorce statistics. The National Death Index, which researchers can use to find out who in their dataset has died, and also the Vital Statistics Rapid Release. The Vital Statistics Rapid Release, which provides access to extremely timely information. It uses provisional data to estimate important statistics for public health surveillance much faster than would be possible using final annual data. So this enables us to recognize and track developing health threats like we did when COVID-19 became a pandemic. And the goal for this is to be a nearly real-time public health surveillance tool. So we're going to explore. We can look under surveillance activities. You can see I'm going to click provisional drug overdose death counts. This information is being closely monitored as these deaths have been rising in recent years. If I click on the provisional monthly national and state level drug overdose death counts, can scroll down and we're able to see dynamic visualizations of this data. So in this first visualization, we can view the death trends over time nationally. And this can also be broken down by state or jurisdiction. In the second figure, we can see, you can view a map of the percent change in death in a 12-month period. And as I hover over each of the states, you can see the percentage change. Orange states are increasing, and blue states are decreasing. To the right of the map is the percent change nationally, which is 2.8%. And underneath this map are the technical notes. It provides details on the data and how these statistics were compiled. Scrolling back up to the top of this page, I want to return to the Vital Statistics Rapid Release. And this time, I want to look at reports. Vital Statistics Rapid Release Reports. And this section is based on the current flow of vital statistics data on surveillance issues. So we can see some recent reports, such as provisional numbers and rates of suicide by demographic characteristics, provisional life expectancy estimates, drug overdose deaths involving xylazine. And these reports can be helpful if you're having difficulty understanding and interpreting the vital statistics data. They provide detailed methodological information, in-depth analyses, and a discussion section for the topic. I'm going to return again to the home page. There's lots of resources. There's NCHS that disseminates information they create through a variety of reports and publications. And there's one more that I'd like to show you. They're excellent data briefs. And this we find under the Publications tab. These are short reports sharing statistics from their various data collection systems. And we can search these by year. Going back to 2007, can search by the survey being used, and also by keyword. I'm going to do a quick example search. If I search nutrition as an example, and I'm gonna pull one up to show. Here's children living in households that experience food insecurity in the United States, 2019 to 2020. And important statistics can be found in the key findings section right here at the top. This brief highlights the age, race, disability, and socioeconomic status, and also the rural-urban differences in the percentage of children living in food insecure households. All of these data briefs, you can see some of the figures. All of the data briefs include a PDF version for printing, and many also include visual abstracts. These can be an engaging way to share the key statistical information in presentations or on social media. And while we are focused on statistics today rather than data in this class, I wanted to quickly point out where you can find publicly available data sets. If we return to the home page and look you'll find links to their available data and information on how to download it under Data and Tools, under Data Access. And also under here on the far right, we'll see the stats of the states. And here you can click on specific states and see statistics on key health indicators as well as birth and death information. We can click on any of the hyperlinks below, which brings up a national map visualizing how your state fits in overall. So for example, I wanted to look at the teen birth rate by state. You can compare the states. You can see lighter colors, darker colors. And this is the data. We can see this is the data from 2021, but we can go back. If we can take a look at 2005 and can see how rates have changed. And here's the data table listed. There's much more information on this site, and I encourage you to spend some time exploring it after this class. Before leaving the site, I just want to mention the option to receive email updates. If we scroll down here at the bottom of the page, there's an extensive list of topics you can choose to subscribe to, so you can be alerted to whenever new information is available in areas of interest to you. But that is it for NCHS. For now, we'll move on to our second portal, and this is MedlinePlus. MedlinePlus is the National Library of Medicine's consumer health portal, which links to information on diseases and conditions, wellness issues, drugs and supplements, and medical tests from over 500 vetted organizations. And here we can use the health topics pages on MedlinePlus to quickly access statistics on a particular topic. So once again, I'm going to share my screen with MedlinePlus. And here we can navigate through the health topics. You can find a topic either through the alphabetical listing or by looking under one of these categories. Say, for example, I was interested in breast cancer. I could click on the B, or I can click on cancers, which takes us into a list of all of the cancer-related topic pages that are available. I scroll down and there's breast cancer. At the top of each of these health topic pages, a top box serves as the table of contents for that page. Here under research is the link for statistics and research. And there are several different statistics resources linked here. You'll see the name of the organization providing the statistics is in parentheses. So breast cancer statistics is from this one is from the Centers for Disease Control and Prevention. Here I want to click on, next we're going to click on Cancer Stat Facts, which is from the National Cancer Institute. And you'll notice this takes us away from MedlinePlus and onto the National Cancer Institute's page, where you can start right in on looking for statistics on a particular topic. So here we have female breast cancer. You can see statistics at a glance. You can see survival statistics. Scroll down even to additional information, more about survival statistics. And so just as when you might use MedlinePlus as a starting point when you're unfamiliar with a particular disease or condition, it can also be a great starting point when you're not sure who might produce statistics on a particular topic. That was our second portal, but we want to pause here for any questions. And
Yes, we've had a couple of great questions come in. And the first two are about NCHS. The first question was, I believe it was in Haynes, and it was the first one that you showed, and they wanted to know, can you filter by state or county on those charts?
I think for some of them you can. I think most of the ones on the national NCHS might only go down to the state level, but I know that we have at least one resource that shows more county-specific data.
Great. Okay, and the next question is about the data in NCHS. Is the raw data usually available to download, or usually do you need to request it, the raw data?
I believe that the data that is under their data access would not need to be requested, but I think it may not be the raw data. So I'd have to look into that a little more, but I know there's definitely going to be some data that will be restricted to protect privacy.
Oh, yes, and Katie says we will talk about some of those next. All right, so the next question, okay, are there databases which include statistics on indirected related health factors like social determinants of health, literacy rates? And okay, so Katie responded, yes, we'll talk about some of those next. Okay.
I think I know of I might be able to, I think I know of a site that something I might be able to answer on that too. Yeah, I have to look for it though. Katie, you ready to dive into the next national statistics?
Sure. Okay, let me share my screen here real quick. All right, and we'll get started with BRFIS, which is Behavioral Risk Factor Surveillance System. So we'll get started into talking about some of those like social determinants and social determinants of health and some of those statistics that you can find about that. But the Behavioral Risk Factor Surveillance System, or BRFIS, is sponsored by the CDC and other federal agencies. It was first conducted in 1984, and now it's the world's largest continuously conducted survey system. And I just want to make sure you can hear me okay.
Yes.
Okay, perfect. And so BRFIS collects data on from adults 18 years and older about health risk behaviors, chronic diseases and conditions, the use of preventative health services, and then uses that data that they obtain to plan health promotion activities. Though sponsored at the national level, surveys are conducted at the state level with all 50 states, including the District of Columbia and U.S. territories, and they oversee thousands of interviews every year. So Burfus uses several different questionnaires for their surveys, and they all consist of the same core set of questions, but they may have optional modules and state-added questions. So before diving into the search for a specific statistic, it can sometimes be helpful to first scan the Burfus questionnaires, which is right down here. So questionnaires by year will show you what questions were asked in any given year. So you can click on that here. Underneath, please select the options below, questions by year in English. And you can look and see which questions were asked every year going back, all the way down to 1984. And then click out of that. And there's also the optional data module by state to see what questions were asked in the state that you're specifically interested in. So I'm going to go back to the home page. So to begin finding specific statistics, I'm going to click on prevalence data and data analytics, and then on prevalence trends and data. So here I have the option to explore by location or by topic. And since the process and the results are very similar, I'm just going to start with topic. Someone mentioned diabetes, I think. They don't have that specific one on here, but you might find some that are kind of related to that, like maybe cholesterol awareness or hypertension awareness, physical activity. So let's see. I'll do tobacco use just as an example, and then current smoker status. And then hit go. Okay, there it goes. It's running a little bit slow today sometimes. Sometimes that happens though. Here we have the 2022 national results for the question, adults who are current smokers, and then the response was yes. So you can see at a glance how one state compares to another, and according to the legend, the darker color states have a higher crude prevalence rate. So you have the option to review their overall results, or you can click by view by to see results sorted by different demographics. So you can look at this by gender, by age group, household income, and other different demographic information if you wanted to. You can also change the data type from crude to age adjusted. So if you wanted to look at it by age adjusted, you're also able to do that. And Burfus has also recently begun providing local area estimates for select metropolitan or micropolitan areas. It doesn't look like they do it for this specific topic, but sometimes right up here by the year, view by response, etc., there'll be an option that says show MMSAs, and you'll be able to find that information about those specific metropolitan or micropolitan areas. And if you scroll a little bit further down, you'll find information about the data source and the measures, how they defined those measures. And you can click on the bar and table option up here in the top corner. So if you want to look at this through a bar graph, you're also able to do that, to look at the data in a little bit different way. And so now you can kind of compare the different states for who answered yes and who answered no. And then lastly, I do want to point out that Burfus does make their data available. So let me go back to the home page again. They make their data available. And so if you scroll back down again and go to the data user guide, am I looking at the right one? Click on, under survey data and documentation. And then if you scroll down and go to the 2022 data and documentation, you can find out information about how to obtain the data from this survey, and some really great guides to help you conduct your own statistical analysis. Oh, and then real quick, it looks like we had a question about Burfus. Are these surveys collected in languages other than English? If so, are all responses together or sortable? I believe they are collected in different languages. If you go and look back through like the Burfus questionnaires, that should have, they also have it in Spanish. And it says, note states can adapt these questions to commonly used Spanish dialects in their areas. I don't know how they combine that data, but I do know they have it in other languages. Okay, so then for state health facts, and just to make sure we are seeing the right screen, you're seeing state health facts?
Yes.
Perfect. Okay. So for this one, we'll look at health insurance and managed care as our examples. And so here you have all the different categories and subtopics that you can look at. We'll look at the, let's see, yeah. So we'll look at the health coverage and uninsured. And then, like I said, you can select different categories. I'm going to look for health insurance status. They changed this on me just from last week. So let's see where we're looking at. Oh, sorry, I'm on the wrong one. So we're going to do health coverage and uninsured. Sorry about that. I was looking at the wrong one. But here's all the different subtopics, and then we'll select health insurance status, and then it kind of narrows that down for us. And you can see a list of data sets related to that particular category. So I'm going to look at health insurance coverage of the total population, which is our very first one listed here. So looking towards the middle column on this table, you can see that 21.2% of the U.S. population in 2022 was covered by Medicaid. And that's the middle column right here, the very top row where it has the United States total. And we can also look at this as a map as well. And again, we can kind of compare the states all at once. And then over here on the left, these filters give us more detail. So under distributions, I can select Medicaid and see the percentage of population on Medicaid in each state. So I'm going to select Medicaid, and then we can see New Mexico 33.5%, South Dakota 13.4%. So you can easily compare the different states with this map. Then we can also look at this through a trend graph, and so we can look at this map over time. So I'm going to change this up here to the trend graph. And for locations, I'm going to do all of the United States. And now you get to see the kind of the trend over time with this. And then the notes section down below, this is where you can learn where the data came from and all the definitions that go along with it. So then going back to the health coverage and uninsured, I'm not going to go all the way back to the home page, but to the health coverage and uninsured, you can also, at the top, there's an option to build custom state reports, which is a cool interactive tool that lets you compile your statistics of interest for a single state or multiple states and create these customized reports. So you see some of this list of indicators that we saw just a few moments ago. So let's say that you're interested in looking at alcohol-related numbers for the Midwest. And so we can look at mental health and substance use here. And then underneath this, we'll do alcohol and drug dependence, and individuals reporting alcohol dependence or abuse in the past year. And we'll click on the little plus over here, add that to our comparisons, and then we'll do select states. And where is everybody joining us from today? I'll pull some of the information from the states. Illinois, New York, and Florida. Okay, those are the first three that I saw. So we'll do, what did I say? Let's see. There's New York, Illinois, and Florida. So we'll compare these three states and then generate a report. And so now we can see, so now the data is broken down by age, and you can refine this data right here in the little gray bar. If you click the little down arrow, you can look at it as a percent or as a number. You can look at it for teens, ages 12 through 17, or for adults. And you can also look at related statistics. So individuals reporting opioid use or reported needing but not receiving treatment for illicit drug use. So you can add on these statistics as well and kind of compare them across the different states. And then you can also download this data in an Excel spreadsheet to be able to filter or manipulate this data further. And you can also share the URL to share the report with others. So you can download the data, you can email it out, you can copy the direct link to this information or share it out. So I'm going to check again if we have any questions. We got people from all over. That's why it's good to see. Okay, cool. So we're going to actually go into some local statistics now. And we're going to look at the census. And this is one of my favorite statistics resources because there's just so much information in the census. So the census is part of the U.S. Department of Commerce, and it serves as the nation's leading provider of data about U.S. residents. As you likely know, the census is conducted every 10 years with a focus on population count. On the website, you'll find statistics about population and people, employment, income, housing, government, education. And then with regards to healthcare, you can find statistics pertaining to disability, fertility, health insurance, and business of healthcare. So there's many different geographic levels, including state, county, zip code, census tract, congressional districts, tribal areas, and you can look at the areas in a geographic way. And the data is current on the site currently goes back to 2000, and it pulls from several other surveys like the American Community Survey, which is conducted annually and has a bigger focus on community needs. So again, there's a lot of that social determinants of health information you might be able to find in here. So on the homepage, we have this very kind of simple search box, and it's showing example prompts that you can enter in there. And if we scroll a little bit further down, all the way down, get started. Yeah, this is what I'm looking for. So the census has a lot of great videos and tutorials to help you build searches and find information. And you can find answers to most of your questions or submit feedback to them and get help. But today we're just going to do a little quick peek at some of the information that is on the census. I'm going to scroll back up to that search bar we saw. So for example, let's say I wanted to find out how many people in Pittsburgh live with a disability. So I'm going to type in disability in Pittsburgh, just kind of what it says in their little prompt down there. So disability in Pittsburgh City, Pennsylvania. So this takes us to the all results page, and you can see the quick answer to our question, which is 14.4% of the population in Pittsburgh is disabled. And that's according to the 2022 American Community Survey. So at the top, you can see that you can look for tables, you can look for maps, you can look at the profile of Pittsburgh. Tables and maps are the main ways that census data is presented. And the site contains over 5,000 tables in general, with new ones added every week. And then the maps, this is data so that you can display in map form, but you can also build customized maps by selecting specific geographic areas and variables from the data tables. So I mentioned you can do this by zip code, you can do this by county, census tract, where you get down to a very, very, very specific geographic portion. One thing that's helpful to notice is the table ID. So it's this blue number here, the S1810. You're able to type in just that ID number in the search bar later to bring up that specific result. So it's a good thing to note if you want to access this data again. So I'm going to click on the disability characteristics, and we'll look at this through the table. So we can look at all the different demographics that go along with this. So we can look at this by disability characteristics, age by disability status, sex, all sorts of different ways that we can look at this information. And up at the top here, if you look at notes, this will give you details about the data and methodology about how this data was collected. And you can export this. More tools, you can export as an Excel file or as a CSV file. So you can also export this information and share it as well. So I'm going to go click on the U.S. Census Bureau logo to take us back to the home page. I'm going to show you the advanced search options real quick too. So advanced search walks you through the search process and checking off your search filters. And there are 4 geographies that are only available through advanced search, which is metro areas, census tracts, block groups, and blocks. So census tracts were created by the Bureau to approximate neighborhoods. They're typically about 4,000 people, and they're the smallest geographic area that the Census Bureau collects and tabulates that 10-year census data. So on the left, you have all of your filter options, and you can search for specific filters. And you can also scroll down further to find the specific filter that you're interested in. So what I'm going to do is I'm actually going to do by zip code. Let's see. And I'm just going to pick a random one from Alabama here. Let's try 35014. Let's see what that one brings up. And click on search. And so now I can look at this very specific zip code and see the profile for this zip code. Or if it'll load. Let's see. Yeah, there it goes. So now we can get like a snapshot of this specific area of Alabama. And you can scroll down and see statistics on populations and people. And oh, sorry, I lost my place here real quick. So you can scroll down and see information about populations and people, their age ranges, their computer use, ancestry, languages spoken at home. Somebody mentioned literacy levels before. So this isn't necessarily literacy levels, but you can see how many people might speak another language at home and what their education level is, which may impact their English literacy levels as well. Okay, so let's see here. I'm now going to go over to our next resource, which is going to be county health rankings. Okay, so this was a collaboration between Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And they pull data from several sources, including BRFIS, and then analyze it and summarize it to produce their annual rankings, which provides a snapshot of a community's health. So we'll be focusing on statistical information that's available here, but I want to mention that an equal focus of this resource is to share evidence-based strategies to take action to address local concerns, growing community power, and improving health equity. So we can jump right in here by either clicking on the tab that says Explore Health Rankings up at the top, or you can just start searching for a state. And I was practicing this earlier, so I already had Ohio written in here. We'll get started by searching for Ohio, just as an example. So the green map here is showing different health outcomes, and health outcomes uses two measures, which is the length of life and quality of life, to rank how healthy a county currently is compared to others. And the counties are ranked from 1 to whatever number of counties there are in the states. So in this case, there's 88, so 1 being the healthiest and 88 being the least healthiest. And the lighter the color, the healthier the county. So right now we have a map. We can also do this by rankings. So the healthiest county, when we sort it by number, is Delaware County is the healthiest county, while Scioto is the very least healthy county. So I'm going to pull up a second map now, and I'm going to look at health factors. So this map uses 4 measures, which is health behaviors, clinical care, socio and economic factors, and physical environment to estimate the future health of each county. And so it can kind of be seen as a precursor to the green health outcomes map that we were looking at. So if we hover over Delaware, which is again ranked the healthiest, it's kind of right here in the middle. And then we can go down here to Adams County, because that's one of the lower, less healthy counties, and we can find more data for Adams County and look specifically at information for that county. So this is the county snapshot, and so in the graph icon, this tracks how the indicator is trending. So from least healthy to healthiest. And if we scroll down here, we can see the different demographics and factors that go into this. And some of these have little trend lines here with the red, the green. So red means that the indicator is getting worse over time. Yellow means it's holding about the same. And then green means that it's getting better. So somebody mentioned, let's see. Trying to think of some of the questions that people had asked. So we can look at an example for that. Okay, so for preventable hospital stays, so if you click on this, you can find out a little bit more about this specific specific data point. And note there's additional indicators that don't contribute to the overall ranking that might interest you. So there's things like physical environment, broadband access. And so you can look at all those different factors here, and you can see how this county lines up in the red line over time versus the United States overall, and then versus Ohio. So you can see how it compares over time for this. And then you're also able to compare counties. And so if you scroll down to this big blue box here and then hit compare counties, you can add an additional location. You can select from peer counties, which will have similar demographic, social, and economic indicators, or you can select from another county within Ohio and compare those kind of side by side. And you can add up to another three counties to look at this if you like. So then the next one that I'm going to be looking at is going to be for City Health Dashboard. Oh, share my screen again, and we're going to do City Health Dashboard. Oh, let me get back to the homepage here. So this resource is from the Department of Population and the School of Public Service at NYU. It's in partnership with the National Resource Network, and it focuses on health in U.S. cities, which is important as more than 80% of the U.S. population lives in an urban area. So the dashboard began collecting data for the 500 largest cities in the United States, but in 2018, and then 2020, they expanded to include small and mid-sized populations with just 50,000 people in them. So they currently provide data for over 900 different cities across the U.S. So there's 43 indicators that they measure in line with those for the county health rankings and roadmaps. But these are focused, and they are focused on health, the factors that shape health, and the drivers of health equity. So some of the indicators may be narrowed down to the zip code or the census tract level, while others are just kind of available at the city level. And then in January, they launched a sister website, which was the Congressional District Health Dashboard, which provides health equity and data equity for all 435 congressional districts to support state and national policy making. So let's see. And somebody mentioned that they're from Missouri. So we'll start by entering a city here, and we'll do like St. Louis, Missouri. We'll take a look at them. And so now you can see all the different metrics that you can look at. And I think somebody also mentioned interested in literacy levels. So I'm going to do third grade reading scores, but you can see all sorts of things like lead exposure, physical inactivity, frequent mental distress or physical distress, low birth weight. There's all sorts of metrics that they look for on here, but we'll do third grade reading scores to see, look at St. Louis. So up at the top here, you can click on more about the metric. So you can find a little bit more about how they're measuring this, how they define them, and then the data availability for that. And you're also able to, sometimes you're able to download the data for the specific metric that you're looking at. Then below that, we have the metric bar. So for the shaded bar at the top, it uses a little yellow marker right here to show where the city falls on the score, and a little triangle to show you the average for the cities, all the cities included in the dash bar. And so sometimes you want the metric, the little yellow bar, to be on this side. Sometimes you want it to be on the left. Sometimes you want it to be on the right. Every indicator is a little bit different. So some of the metrics have demographic details. So yeah, if you scroll back up here, sometimes you can look at the different demographic details for this. So looking at by race and ethnicity or by gender. And similar to county health rankings, you can also compare cities as well. So let's see, I'm going to pick one from the list. Scroll down, get out of California. There's a lot of cities in California. We'll do Conroe, Texas randomly just to kind of compare these a little bit. But now again, just like with the counties, you can kind of compare this information back and forth across the different counties. And then the fourth resource that I'm going to go for is for rural health information. So if we have anybody that's in rural areas, I got a resource coming up for you. So let's see here. Let's do rural health information. So the Rural Health Information Hub is funded by the Federal Office of Rural Health Policy and operated by the Center for Rural Health at the University of North Dakota School of Medicine and Health Sciences. So it serves as the national clearinghouse on rural health issues. There's an incredible amount of information on this site related to rural healthcare delivery and population health, including in-depth topical and state guides, interactive maps, county-level data, case studies, toolkits, and opportunities for funding and collaboration. So on the homepage here, you can see there's 5 tabs running across that can to easily differentiate content. The topic and state tabs contains over 50 topic guides. Click on that. And for each of the U.S. state, territories, and commonwealths. So the guides are grouped by subject matter, and you can also have the option to browse an alphabetical list of topics. So I'm going to look at the browse all topics, and then under how-to guides, I'm going to look at the finding statistics and data related to rural health. So this can be a really handy page to bookmark or to bookmark or to just take note of. And this table lets you quickly learn what topics are covered. So from the finding health statistics and data related to rural health, they have a data sources and tools relevant to rural health. So if you click on that, this is all the different sources and tools, and you can see from here what topics are covered, the ease of use for that particular guide, the geographic level of the data, and how frequently that content is updated. So this is a good kind of go-to resource to look at. And then the very last one that I wanted to mention, I'm not going to do a demo on this one, but it's going to be the national, it's called NANDA, the National Neighborhood Data Archive. And so that resource it's from the University of Michigan for social research. And I just learned about this resource, so I'm excited to just kind of point to it. But this resource is open, curated data sets that focus on social determinants of health. Researchers can download the raw data and use it in their research. If you want to learn more, they recently did a webinar with Region 3's office, and you're welcome to go and watch that recording. But they have a neat cognitibility section on their website, and so this looks at how your neighborhood supports cognitive health and through places to be physically active, if there's parks, if there's churches, if there's libraries. And they also look at a lot of different things that some of these other resources didn't. So again, it focuses on social determinants of health. There's also things about crime rates, police districts, polluting sites, and things like that within that resource. So I wanted to see, did anybody have any questions about any of the resources that we have covered today?
No questions that you have not yet answered, but everyone is welcome to share and chat.
And I know it's a lot of information in this. We covered a lot of different resources, but I really encourage you to think back to explore these resources. Just go to the websites, poke around a little bit. We only were able to do like a very brief look at what some of these are really able to do. So these are a lot of great resources out there. And then someone asked, can you repeat the step on MedlinePlus to find statistics and research category? I can do that real quick while I have.
Or I can, Katie.
You want to do? Okay.
Yeah. Yep. Just a second. Yeah, I'm sorry, I was going a little fast at the time. So if we're on a health topic page here, there's this box with all of the kind of a table of contents. So all of these are links on this page, but under research, there's statistics and research. And this is where there's different, so these are some different sources and different places where you can find those statistics. Does that answer? And these are all links like externally, but they're all they've been vetted, and that's why they're on. So they're reliable sources. And I didn't see any other new questions, but I was going to just share a couple resources for if people are more interested in more socio-environmental determinants of health. There's two resources I put in the chat that have some similar things where you can compare socioeconomic indicators. They're both have some like good, nice mapping capabilities as well. And I think a question did just pop up. Do these health statistic websites also have reports that summarize their data?
Yes. I know for like the KFF with the state health facts, they probably have several reports that come out. The Census has a lot of reports that they kind of summarize overall trends and things like that. If you go to the Census website again and kind of, it's probably more under like their resources, like the Get Started guide and Explore resources. They probably have some really great summaries there. And then county health rankings and roadmaps. They have, let's see, those would be the two off the top of my head that I know have a lot of like overarching reports. Like KFF, I'm pretty sure does, and I know Census has quite a few. Well, they'll give a really great summary and point to some very specific information on there. Are there any open access issues with this type of data that the presenters are aware of? Any data you wish was more accessible? I know with NANDA, the one that I just kind of briefly pointed to, that is an open access one that they've curated. But when I was talking to the people that help run it, I know that there were some concerns because they're trying to curate that data. It takes a little bit longer to get it to be all open access and make sure that they're still ethically sharing it and safely sharing it. But for the rest of these, it should be pretty open, especially any of the CDC resources. I know they try and share as much of their data as they're available to, but I wasn't sure, Christine, you want to add on to that at all?
I think maybe there sometimes is there delay, like you said, Katie, that the data may not always be available as quickly. But yeah, I think that at least in most of these resources, the data is pretty open. I see also data sources. Oops, sorry. So I think actually this was something I was just thinking of. So they also meant to include data sources in the world we might not have covered today. So not just what we covered today, because a lot of what we covered is mostly federally funded, there is like access. And then another person asked, can we access their data policy on what number they are suppressing?
For that question, I would look very carefully at any of the notes or the methodologies. And I think that was for most of the resources. They have information about how they've defined that data, how they've collected it, how they've analyzed it and put it together. So for that, I would look through their notes and methodologies for those types of answers.
I think also you can look for the data user agreements, and it's possible also that some data that's could be like there might be some difficulties with interoperability, especially when you think about different states, how different public health departments collect data. So kind of going back to the previous question, but sometimes it can be hard to compare different areas or different measures when things aren't as standardized.
And then somebody had a question about the Rural Health Information Hub. If we could see an example of the Am I Rural report on Rural Information Hub, and how to determine if you're considered rural or not. And I know that information can kind of vary depending on the organization. Sorry, Chrissy, I'm gonna take the screen back real quick. I know one thing that they do have in this. So like under the find rural health data, the rural data explorer, like if you click on this and then the rural data explorer, so you can kind of see this map. And so the darker it is, the more kind of urban it is. So we'll do like Kansas is pretty rural. So we'll do out here like Logan County and look at this one. And you can see that if it's considered metro or non-metro. I wonder if they define that by exactly how they're looking at that. I'm not sure exactly how they're defining metro or non-metro on this one. I might have to look more into that and get back to you because I'm not sure exactly how they're finding that.
Do we want to go on to the next slide, Katie?
Yeah, I can bring good.
Okay.
So the last little part that we're going to do is we'll return back to the question that you formulated at the beginning of this and kind of look at part 2 of that exercise. So this involves working through steps 2 and 4 of that 4-step process. So we'll take a couple minutes to think through step 2, which is to choose between the best resource to answer your question. Which resources that we covered today would most likely have the data that you need to answer your question. And then step 3 is which is to search and evaluate what you find to see if it's appropriate and sufficient to answer your question. And then again, step 4 is just kind of repeat as needed. We got a couple minutes. I think we'll go ahead and pause here so you can kind of think through which resource, and if you want to share this in the chat too, think back to the question that you formulated. Which resource do you think would have the information that you would need to answer your question? And we'll just give it a couple minutes here to think through that. Okay, awesome. Well, thank you everybody for joining us today. And we had one more question. Do you know offhand if any of these sources include statistics for pets in homes, veterinarian clinics, etc.? I think NANDA might actually have some of those, some data sets around pets in the home, because I know that's some questions sometimes of mental health and how pets affect that. I think here, so we've reached the end of our class. Christine, can you go to the next slide, please? But yeah, well, thank you everyone for joining us today. We've reached the end of our class content. And if you have any questions in the future, please feel free to reach out to us. The link that will bring you the class evaluation is shown on the slide. Molly will also put it into the chat for you. It usually works best if you copy and paste this into your browser rather than clicking on the link directly. And once you complete the survey, you'll be able to claim your CE credit. But thank you everyone for joining us today, and I hope you learned something new. So,
Thank you, everyone.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.